Let's talk about blood vessels and circulation. So blood is not blue. However, in pictures, veins are colored blue and arteries are colored red. And the purpose is to indicate oxygenated and deoxygenated blood flow. So when you see red vessels, would be bright red, the blood in there, because it is oxygenated. And the blood that is indicated as blue is deoxygenated. So it's on the way back to the heart and it has less oxygen in it. So it's going to be a darker red, but not actually blue. Okay, the structure of blood vessels. There is the lumen. That's the empty space in the blood vessel. That's where the blood flows through. And then there are 3 layers. So the tunica externa, it's also called adventitia, but I will test only the tunica externa terminology. And that's connective tissue with elastin and collagen fibers that allows it to be stretchy. It also allows blood vessels to be attached to tissues, okay? And then we have the tunica media, and it's muscle, smooth muscle, and that's often the thickest layer. And then we have tunica interna or intima, but again, I will test the interna version of it. And that's a single layer of cells. It is simple squamous. Remember squamous, the like egg shape, the flat epithelial cells. So it's simple squamous epithelial, and it lines the lumen. It creates that surface that blood is going to flow past. Here we can see the 3 layers. We have the tunica intima or internal and interna, and that is this single layer of cells lining the lumen. This is the lumen, the empty space. Then we have the tunica media, and that is the muscle layer, smooth muscle. So this looks like smooth muscle tissue here. Okay. And then we have the tunica adventitia or externa. So externa, interna, and then the media in the middle. And that has connective tissue like collagen and elastin, and it serves to provide some stretch for the vessel, but also to allow it to be attached to tissues and kind of stay in place. All right, so arteries, one of the vessels, they carry blood away from the heart. Artery starts with A and so does away. The tunica media is the thickest layer. That's the muscle, remember. So it allows the vessel to change in diameter, which regulates both blood flow and blood pressure, in addition to body temperature. Okay? In an artery, you can feel your pulse. And what is a pulse? Well, it's the rhythmic dilation of an artery due to the beating of your heart. So your heart beats and pushes blood out, and then the arteries continue to squeeze, 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 squeeze along the way to continue pushing that blood. Remember, they have a thick layer of muscle. So one tip is not to use your thumb when you find a pulse, because your thumb has a pulse, so it can cause you to miscount. And we're going to talk about pulse in a later lesson, but here you can see some of the locations where we can actually test our pulse. Veins. Veins are the opposite, meaning they carry blood to the heart, and they have a thinner tunica externa and thinner tunica media than arteries. So that means they have thinner walls, but a bigger lumen, so a bigger empty space for blood to flow. In fact, about 60% of your blood at any given time is found in veins. And veins contain valves, valves, V, to prevent backflow. Because remember, they're going sort of against gravity, and they've got to go up, back to the heart. Okay, so they need valves to keep the blood flowing in the correct direction. Here you can see valves working as your muscles will contract involuntarily and to help squeeze the blood along. And you can see when we look here for where blood flow is in veins, 60%, and you can see the rest is primarily in, here's your arteries. Here's just pulmonary circulation in your heart and your capillaries. So capillaries is the least. What are capillaries? Well, they are the smallest blood vessels, but they are the most numerous, even though they don't have the most blood there. but they're only one cell layer thick. They literally only have the tunica interna. They do not have the other layers. And why? Because exchange of materials happens here by diffusion. And if it was many layers, diffusion would take too long. So it is simply one cell layer thick. So that means nutrients can diffuse out and waste can diffuse back in to be gotten rid of. Okay. So the general idea is that blood flows through arteries from the heart, okay, away from the heart, and then the arteries eventually get smaller and smaller and smaller and smaller until they are small enough to be capillaries, and exchange of gases and nutrients and wastes happens here at the capillaries, and then the capillaries become small little veins, and then the veins get bigger and bigger and bigger until ultimately leads back to the heart through two main vessels, the superior and inferior vena cava. All right, so here's another model just so you can see. Veins have the largest lumen. Arteries have the thickest layer of tunica media. Capillaries are just one cell layer thick. Vasodilation, so that means dilating or the widening of blood vessels. What does that do? Well, it helps to decrease blood pressure, less squishing on the blood. It can help to lower your body temperature by getting rid of excess heat. So when does vasodilation happen? It could be because you're too warm, because of exercise, it could be because of a medication side effect, even from eating spicy foods or drinking alcohol. Vasoconstriction, on the other hand, is the constricting or narrowing of blood vessels. And this serves to increase blood pressure, so put more squeeze on it. It also serves to raise your body temperature in response to you being cold. So vasoconstriction can be due to cold temperatures, side effects of medicine as well, but also could be due to fluid loss. So that means from wounds, from burns, from vomiting, from diarrhea. So you could end up having lack of blood flow to your fingers, especially in your toes, for any of those reasons. Our cardiovascular system is a closed system. There are three closed loops that begin and end at the heart. So there's pulmonary circulation that goes between the heart chambers and the lungs. There's a right loop and a left loop. There's systemic circulation between the heart chambers and the body. There's an upper body loop and a lower body loop. And then there's coronary circulation. That's between the heart chambers and the heart tissue itself. So heart is the hardest working muscle. That means it needs nutrients from blood, right? So blood has to actually purposely go to the heart tissue. So you can see loops we have from into the lungs, from into the body, and then also here from and to the heart. Coronary circulation. The blood in the heart does not nourish the heart. It's just kind of like flowing through. It's the vessel for it. But coronary arteries, right here, supply blood to the heart. And you can see this vessel right here is the aorta. And you can see that the coronary arteries come off first. Why? Well, there's no point in anything if the heart doesn't get its blood supply. So it has to go to the heart first. So, and then coronary veins, right here is an example of one. They empty into the right atrium like the superior vena cava and the inferior vena cava. Note, the left ventricle works the hardest. It's got to pump blood to the whole body, so it needs the most blood. So when you look at a picture, you will see more blood vessels concentrated at the left ventricle. All right, so here we can see coronary circulation from arteries to veins. And here you can see in this image of a heart, all of those arteries and veins on the outside of the heart. All right, systemic circulation. So that's from the heart to the body that has blood that is rich in oxygen. And then from the body back to the heart, that is blood that is less oxygen in it. And their exchange of waste and nutrients are going to happen at capillaries, like all connections between arteries and veins. The exchange happens at the capillaries. And then we have pulmonary circulation, so there's from a heart to the lungs loop. And what's interesting this time is when the heart pumps the blood out, the blood is still low in oxygen. So the blood going to the lungs does not have oxygen, but the blood flowing back does. So here's a unique situation where the pulmonary artery, which is going away from the heart, it has oxygen poor blood. And the pulmonary veins coming back from the lungs have a lot of oxygen, oxygen-rich blood. That's the only artery and vein where that is swapped. Okay, now for some names of blood vessels. Now, only the vessels of the heart and the aorta will you need to identify in a picture. The remaining vessels you need to know by name and location, like where they are. But I'm not going to give you a picture and say, what is this vessel? But when we're talking about the heart, and we're talking about the vessels of the heart, yes, you need to be able to identify them in a picture. So what do I mean? You have to be able to, if you're given a drawing of a heart, be able to identify the aorta. That's the largest artery. In fact, the aorta is about the diameter of a garden hose, okay? And it carries blood to the body and away from the heart. Now, what you need to know are the vessels of the aorta. So you need to know right here that the vessels coming off first are the coronary arteries, and they're going to supply blood right directly to the heart tissue itself. And then we have, let me just switch the color here. Then we have the ascending aorta right here, okay? The aortic arch right here, and then the descending aorta here. And then there are three branches off the aortic arch, okay? The first one is the brachiocephalic. The next is the left common carotid, and then the next is the left subclavian. The brachiocephalic will eventually branch into the right subclavian and the right common carotid, similar to the left, okay? Now, the inferior vena cava, so we're looking for a vessel that is coming from the lower part of the body, and we want it to be on the right side of the heart, okay? We have superior vena cava, so again, we're looking for something that is a vessel that's coming back from the upper part of the body, and again, we're looking on the right side of the heart. The pulmonary artery, so the pulmonary artery is going to leave the right ventricle and branch into a left and then a right pulmonary artery. The right one going to the right lung and the left one going to the left lung. So right here is the pulmonary trunk, and then we have left pulmonary artery and right pulmonary artery. And then we have pulmonary veins, and they're a set of two on both sides, and we have right and left. So the right pulmonary veins come back from the right lung, and the left pulmonary veins come back from the left lung. And the remaining vessels you need to know by name and location only, meaning I'm not going to give you a picture and say, what is this vessel? Well, you may have to be able to identify the vessel when I give you a description of it, okay? So that's the carotid artery, that's in your neck, so it carries blood up to your brain and your head. And then we have the jugular vein. It's also in the neck, but it's carrying blood back to the heart. Okay. Now the remaining vessels have an artery and a vein. The images in this slideshow focus on the artery, but remember there is a vein component. And remember in pictures, the only way to tell the difference in colored pictures is that the arteries will be red and the veins will be blue, okay? All right, so the brachial artery, that's in your upper arm, right? Think the brachial region. We have the thoracic artery, that's in your chest. We have the hepatic artery, that means liver. We have the gastric artery, that means stomach. We have the renal artery, that means kidney. We have the subclavian artery, that means under the clavicle. We have radial artery, that means in the forearm, in the antebrachial region. And radius, remember, when we look at our hand, our arm, no matter which way it is, the radius is always on the thumb side. So it doesn't matter which way I have my hand, the radius is always on the thumb side. And then the ulnar artery, also in the antebrachial region in the forearm, but the ulnar artery is on the pinky side. Whichever way I have my hand, it is on which side? The pinky side. We have the femoral artery, that's in the femur, right? We have the popliteal artery, that's along the posterior, the back of your knee. We have the anterior and posterior tibial artery. So there's anterior tibial artery and posterior tibial artery. And they are going to be along your lower leg, okay? Anterior tibial artery is closer to the front, posterior closer to the back. And then we have the dorsalis pedis artery, and that is in your foot. Interestingly, this is a vessel that is commonly checked when someone has diabetes. A person with diabetes often has issues with circulation, so doctors will feel for that dorsalis pedis pulse to make sure that there's enough blood flow to the foot. And there you have it. That was types of vessels, types of circulation, and the names of blood vessels. I hope you learned something new today.